and today I will be showing you the different breastfeeding position. But before we start the discussion, I want you to know that there is no right or wrong to hold and feed your baby. The more important is that you both feel comfortable of your own preferred position to feed your baby. So now I will discuss the different breastfeeding position. The first one is the laid back breastfeeding position, or what we call reclined position. The laid back breastfeeding or reclined position is also known as biological nurturing and is often the first mom's try. Biological nurturing allows breastfeeding to become more naturally and easily for both the mother and child. There is no wrong or right to do this technique, but there are some basic guidelines. The first step is to lie back in a reclined position of your bed, a sofa, or a chair and get comfortable. If you would like, you can use pillows to support your back, neck, and arms. The next step is to place your baby on your stomach with their belly touching yours and their head up to the level of your breast. As the baby lies on your chest, gravity will help them keep their position securely on your body. After that, the baby will then smell and feel their way up to your nipple. Once they find it, they will move their head back and forth, open their mouth wide, and begin to nurse. The baby can do it by themselves, but you most likely want to get involved. You can hold and support their body, lead them to your breast, touch them, or just snuggle with them. For better understanding, this is an example of lie-back breastfeeding or reclined position. And that was the lie-back breastfeeding position. We will now go to the cradle hold breastfeeding. Cradle hold is a classic position that most of us picture when we think of breastfeeding. So the first step is to sit upright and place your baby on his side. The baby's head is cradled near your elbow and your arm supports the baby along back and neck. You and your baby should be into tummy to tummy position. A pillow or cushion behind your back and a breastfeeding pillow across your lap, propping up your baby or your arms may give you more support and it will avoid strain on your back and shoulders. If you are using a breastfeeding pillow, make sure that it doesn't lift your baby too high. Your breasts should remain at their natural resting height to avoid sore nipple and strained latch. For better understanding, here is an additional example of cradle hold. So now we will come to cross cradle hold. This position is similar to cradle hold, but your arms switch roles so that your baby's body lies along your opposite forearm. Here is an example of cross cradle hold. The aim of this position is to support your baby around his neck and shoulders and to allow him to tilt his head prior to latch. This is a great newborn breastfeeding position and is also good for small babies and to those with latching difficulties. Because your baby is fully supported of your opposite arm, You have more control over his positioning and you can use your free hand to shape your breast. For additional knowledge, here is an additional example of cross-cradle hold. So now we will come to the next breastfeeding position. So the next position is the rugby ball hold. Rugby ball hold is a good position for your twins as you can feed them at the same time as well as cesarean babies as there is no pressure on your tummy and scar area. So the very first step is to sit in a chair or in a bed with a pillow behind your back or along your side. Then place your baby on your side under your arm with their hips close to your hips. Then the baby's nose should be at the level of your nipple. Support your baby's neck with the palm of your hand and gently guide them on your nipple. For better understanding, I will attach here an example of rugby ball hold breastfeeding position. So now we will come to the side lying breastfeeding position. Side lying position is a good position if you have had a cesarean or difficult delivery or if you are breastfeeding at the middle of the night. So the very first step is to start by getting comfortable lying on your side and your baby lies facing you so that you are both tummy to tummy. Then, make sure that the baby's nose is at the level of your nipple and your arm is above their head. Then, check to make sure that your baby's ear, shoulder, and hip are in a straight line, not twisted. Then, put some cushion or pillow behind you for support. A rolled up baby blanket behind your baby will help them secure their position, but make sure that you will remove it after feeding your baby. If you got a pillow under your head, make sure that it's not close to baby's head and face so that it will not alter the baby's position. Then, use your free hand to support and guide your baby to your breast. And that was the side-lying breastfeeding position. For better understanding, I will attach a photo here that illustrates a side-lying breastfeeding position. And that was the 5 common breastfeeding positions.